Now, for next up, we'll look at the social consequences of infertility. Now, social consequences of infertility is more of like, okay, you are not being able to have a child. So, how will the society look at you? Of course, it will affect you. Okay, you might feel like, okay, I don't care, but there's a way it is affecting you. Of course, there's a way it affected you to the level of you saying you don't care. Okay, so what are the social consequences of this? So, infertility can lead to a lot of societal issues, right? Including a lot of things. Now, let's just look at them. So, on your psychology and your emotions, it can lead to depression and anxiety. You are not being able to have your own child. Okay, there's loss of self-esteem. There's social isolation. Okay, so any events that have to do with set meetings, your mates from high schools are coming to set meetings. You don't have a child to come with. Probably, let's say, after 15 years of graduations, 10 years of graduations. Okay, and you might not actually not like it. So in your marriage and relationship, it can lead to blame. Partners can be blaming each other. Can lead to sexual discomfort, dysfunction. You're not really interested in sex again. Okay, could lead to divorce or separation. Now, gender stigma and cultural pressure. Women are disproportionately affected. Okay, so we need to actually educate ourselves that all this infertility stuff is actually 50-50 chance that the issue could be from the woman, the issue could be from the man. Okay, sometimes the issue is even from the both people, right? But men don't really like to be called infertile, all right? So it shouldn't be like that. Social exclusion, violence and abuse. On the economic consequences, you spend money running from one hospital to another. Okay, that's where you appreciate how God made some things to go on naturally. Okay, cost of treatment, loss of productivity, social mobility, and all of that. Okay, so community and public health implications is population dynamics. So, do you understand? Women are getting infertile so much, we won't have the young population to replace the old population. Policy neglect. Okay, then assisted reproductive technologies will be so much in use. Okay, which will not be that nice. Okay, so this is what we got for the social consequences or social impacts of infertility.